Folks, thanks for joining us here today on Financial Issues. I've got a very special guest. If you heard that last segment there, we were talking about what's going on with Medicaid, and so I wanted to bring on an expert to talk to us about this. I've got Rachel Barkley. Rachel's the director of the ABLE program at the National Center for Public Policy Research. She's got a decade of experience connecting members of Congress, state and national think tank leaders, corporate stakeholders, state legislators, governors, advocacy professionals, media influencers around shared goals. She's overseen the strategy for multi-state issue campaigns. She's executed many communication plans, managed the development of policy agendas, and advanced federal legislation spanning a variety of issues and committees through coalition action. She knows her stuff. And she also has a fascinating personal story, which has made a huge impact on how she approaches public policy issues, particularly concerning healthcare, disability, safety net, policy reform, etc. Rachel, it's a delight to have you on our program. Welcome to the show.
Thank you so much for having me, Seth. I'm so glad to be here.
Absolutely. What I'd like for you to do, please, is just begin by telling our audience a little bit about you, who you are, the work you do at the National Center, and then your personal experience as well and how that has impacted this work that you do.
Yes, yeah, I'm glad to. So as you said, I'm the director of the Able Americans program at the National Center, which is a nonprofit think tank. And I came to this work after, well, thank you for reading my long bio there, but after a decade of work in public policy. So I worked on Capitol Hill. I was in the room during the last big, beautiful bill in the Trump administration, which was the Tax Cuts and Jobs Act, and saw how bills are made at the federal and state level. And that was mostly in my 20s. I had gotten married in my late 20s, and my husband and I were expecting our first son the week that I turned 30. So we're happily awaiting our first baby. We had just bought our dream home and down Capitol Hill area, and everything was going according to Plan A in our lives. We'd been married 3 years, and I had this healthy baby, and everything still was going pretty well. And then I had this neck pain for a while, but didn't think anything of it. Doctors didn't think anything of it. But then 2 weeks after I had my son, I woke up, asked my husband to bring me the baby, and could not move my leg at all. It was just mysteriously paralyzed. We go to the ER. We spend a couple days getting tests in the hospital. You know, why is this healthy 30-year-old woman paralyzed? And find out that I had an extremely large tumor growing inside my spinal cord. It was just, the most unimaginable thing that can happen. Come to find out later, this is incredibly rare. So few people have this happen to them, and especially not young, healthy people. I had run a marathon in my 20s. I had climbed Half Dome. I was incredibly, I was a healthy eater. So this just came out of left field and knocked me off my feet. And ended up having a surgery to remove that spinal cord tumor. And praise God, lived through the surgery, and the surgery went pretty well, but it left me paralyzed from the shoulders down. So no movement. And I'm wondering, how am I going to be a mom? How am I going to be a wife? How am I going to be a woman like this? And went through, months of rehab. During my recovery period, I almost died from a pulmonary embolism. And finally, started seeing signs of life through lots and lots of prayer, healing prayer, and hard work and physical therapy. This is actually, next week is my 6-year anniversary of this happening. And I've walked a mile on the treadmill. I can move my arms and legs, and I have had 2 more healthy children since then. So, God's been good. I've had incredible healing. And through all that, though, I had this past in public policy. And once I experienced some healing, got back on my feet from this kind of medical trauma, I had the opportunity to work on policies that help people with disabilities, and was able to meld my personal experience with a disability now. I use a wheelchair probably 80% of the day. My experience being disabled, going through this crazy medical system that we have, and then and know how that affects policy.
Rachel, what a tremendous story. Thank you for sharing that with us. And I say yes and amen to that. What a testament of God's grace and protection over you. And congratulations on 2 more children and getting to be able to move body parts now. What a gift that is. That's just so cool. And, that I kind of wanted to follow up with you on that because I think that's really powerful for us to kind of hear. How did your experience impact how you now view these public policy issues, particularly when it comes to disability care?
Yeah, it really isn't until you go through something, and this is probably, across the spectrum of things,
Yeah.
but particularly with disability, until you have a family member, you yourself go through this, you don't realize how many things every single day impact you. So
Yeah.
everything from sometimes when I go to a restaurant with my family, there isn't a way to get inside. There's multiple steps to the front door, and either I
Right.
have to go through the back door in the kitchen, or I can't get into the restaurant at all because it's not accessible. So things like that. When we were house hunting, to try to find a house that accommodates my family, that is one level that I can get in and out on my own, we couldn't find houses that were accessible to a wheelchair,
Yeah.
and to the very cost of living. People who have disabled children or disabled themselves, there's a high tax on us for medical care, for making accessible renovations in houses, for everyday things like outfitting our cars with hand controls to drive. There's so many expenses. It's very expensive to live like this. And then the most burdensome thing is if you have to depend upon the social safety net in the country. So we're talking about Medicaid and Social
Yeah.
Security, disability insurance, because those programs I found out are just riddled with limitations that keep people with disabilities in poverty. So
Mm.
you can't get Medicaid health coverage, which covers an in-home caregiver if you need someone to help you with some medical tasks at home or to bathe you. So when I got out of the hospital, I was not able to sit myself up in bed, to use the bathroom, to shower myself for a few months. And private insurance didn't cover that kind of caregiving. And so my private plan didn't. And so my husband and my mom moved in to help us. But a lot of people don't have that option. What if you don't have a parent who has that physical capability to help
Yeah.
you? And so I realized the only way in this country you can get that kind of intensive care that people with disabilities need is through Medicaid. But to get on Medicaid, you have to bankrupt yourself. You can only have
Mm.
$2,000 of savings. And if you're married, you can only have $3,000 of savings. So you can't save for and prepare for a future if you're a person with a disability. You're kept in poverty in order to get the health care you need.
Boy, that's so well said, Rachel. I'm so glad that you brought that to light for us. It seems just absolutely ridiculous to me, to get this kind of help from the government, you have to essentially make yourself poor. And it really does remind me, so many people, they'll use the fallback of, okay, we just need to get the government to provide more help and we'll be good. The problem is Ronald Reagan famously quipped the 9 most dangerous words you can hear are, I'm from the government and I'm here to help. And it seems like the help is often more harmful and hurtful. And so my question for you is, what is the solution? What's the solution to true lasting protection and care for Americans who have experienced the things like you've experienced?
I think what it comes down to, and I think about, especially when it comes to Medicaid, which is the program that was intended when Medicaid was created in 1965, it was made for the most vulnerable, a
Yeah.
true safety net for the disabled, for elderly, for pregnant women, for children, the most needy among us. And over time, after the Affordable Care Act passed, this program was stretched to fund just based on your income. And it stretched, and over the past 10 years, 17 million people, new people, were enrolled on Medicaid. These are non disabled people. These are people who aren't working, but could be working in a lot of cases, and could be on private insurance if they got into a job and got to work. And so the program has been stretched so thin that it's been watered down for those who need it most. And on top of that, so that there's 2 populations on Medicaid. There's the medically vulnerable, the truly needy that we talked about from the 1965 original Medicaid.
Yeah.
And then there's this expansion population after the Affordable Care Act, the last 10 years. And the expansion population, does not have to comply with that asset test that I just talked about. They don't have an asset test. So you're talking non-disabled individuals don't have to comply with that. Additionally, states actually get more money from DC. They get 90 cents on every dollar to fund the expansion population, the non-disabled population, where they get only around, it varies, but around 50 cents for every dollar for the disabled population. And so this inequity has driven poor incentives, stretched the system thin, and it has not properly had states focus on the disability population. And so, that caregiver care I talked about, people with disabilities really needing, many states, because they haven't funded it adequately, have wait lists. In Florida, the wait list is 22,000 people deep. So you have to wait through 10 years, 15 years to get a caregiver for your disabled child in the state of Florida.
Crazy stuff. Rachel, I appreciate you bringing this to our attention so very much and sharing your experience as well. I would love to have you back on our program. I know that we're running out of time here quickly, but before we end this segment, can you just tell our audience really quickly, how can they follow the work that you do?
Yes, you can go to ableamericans.us, so ableamericans.us, and you'll find all of our policy work, all of our op-eds, and I look forward to sharing more.
Yeah, that's awesome. Rachel, thank you so much for coming on our program. Your story was a blessing to me, and I'm sure a blessing to our audience as well. We'll be lifting you up in prayer also. What an encouraging story, and we're so grateful for you and folks like you who are trying to reform a system that truly is broken. So thank you so much.
Thank you, Seth. I appreciate it.
Absolutely. Folks, again, that's Rachel Barkley. Rachel of the National Center for Public Policy Research. She's the director of the ABLE program. Make sure to follow those links that she had mentioned there, folks. Really, really good stuff there. I do hope that we can take to heart what she had said there. That's really good.